Welcome to Bloodline Breakthroughs, Innovations and Inspiration. My name is Yulissa Baldwin, and I'm the Director of National Patient Education at Blood Cancer United, formerly the Leukemia and Lymphoma Society, and I will be your host today. We welcome you to our video podcast or vodcast series and hope you will join us for future episodes where we discuss the latest advances in treatment for blood cancer, as well as hear inspirational stories from blood cancer patients and survivors. On today's episode, we will be speaking to Tony Newberne, who will be sharing his experience with CAR T cell therapy. Tony was diagnosed with multiple myeloma in 2013 at just 39 years old. After 12 years of continuous treatment, including a stem cell transplant in 2016, he was given CAR T cell therapy in May of 2025. He found out in September of 2025 that he was in complete remission with no evidence of disease. Throughout his time living with myeloma, Tony joined Blood Cancer United, then LLS, as a volunteer advocate in 2022 to share his personal experience with blood cancer to state and federal lawmakers. He has worked diligently as the North Carolina advocate leader to make a difference in public policy for blood cancer patients around the country. Welcome, Tony.
Hi, thank you for having me.
Well, thank you for being here with us. So, our episode today is on CAR T cell therapy, which is a personalized immunotherapy where a patient's own T cells are genetically modified and then infused back into the patient to use their own immune system to recognize and attack cancer cells. I would like to point out to our viewers that this therapy is currently approved for some leukemias, lymphomas, and multiple myeloma. We'll have a link at the end of the episode for more information. But Tony, before we get into your experience with that, let's discuss all that led up to that procedure. So you were diagnosed in 2013. How did you find out you had myeloma?
Yes, 2013, correct. So before the diagnosis, there was a fall. Um,
Oh,
it was a beautiful day I had just spent at the mountains at the Blue Ridge Parkway, and I was working with a client the following day and attended to her form, and I lost my footing and I fell back into a hole. So I came home that day and I just wasn't feeling myself. I wasn't feeling well. So I went to the emergency room and wanted to get some x-rays to make sure that everything was okay. And got some x-rays, no real incidental findings there. So they sent me home with a script of muscle relaxers.
okay.
So things progressed a little worse for me where I had to go see a neurologist. But what I didn't know after seeing that neurologist at the time that my bones were severely compromised and the fall led to multiple lumbar fractures of my L1, my
Oh,
L3, and my L4, and ultimately uncovered something far more serious. I just have to emphasize all patients are different um, through this disease of an incurable cancer, multiple myeloma. But imagine being 39 years old and told you have high risk multiple myeloma, 98% of cancer throughout my body. I was given a 30% chance of making it out of the hospital alive, a 50% chance of living 1 year. I was in complete renal failure at the time of my diagnosis. My hemoglobin was at a 6.8. I required blood transfusions, radiation, rehabilitation to walk again, um, two back procedures, a stem cell transplant, and eventually CAR T. And on September 18th of 2013, after extensive labs and testing, it revealed abnormal protein levels. A bone marrow biopsy confirmed that I had multiple myeloma. And hearing the word cancer at 39 was surreal. I remember thinking, how can this be happening? But very quickly, I shifted into fight mode. I realized that while I couldn't control the diagnosis, I can control how I responded to it.
yes.
And I chose to fight.
I love that. Yes, you can definitely choose how to respond to it. That's a very important thing. Now, you touched on it a little bit, but what treatments have you had over the 12 years prior to CAR T cell therapy?
Yeah, so over 12 years, I've underwent continuous treatment. It was truly a marathon, not a sprint.
Mhm.
My journey included multiple lines of therapy, combinations of immunomodulators, prednisone inhibitors, um, monoclonal antibodies, and steroids. There were like four different lines of treatment that I was on prior to going into um, CAR T, as well as in January of 2016, I underwent a stem cell transplant. That was a major milestone. Um, it gave me more time, and I
Yeah.
am incredibly grateful for that. But as many myeloma patients understand, this disease can be persistent. Um, Over the years, we adjust treatments as needed, always staying one step ahead of progression. And on May 6th of 2025, I received CAR T therapy. Um, 12 years, no breaks, just moving forward.
Yeah. Yeah, that's a lot of time to just be on continuous medication. Now, the stem cell transplant, was that autologous, so using your own stem cells?
Correct. Yes, it wasn't autologous stem cell transplant.
Okay. And so then with changing the other drugs, your treatments, that was as they were looking to see you progressing potentially, or maybe side effects that made you change those different drugs?
Yes, the first one that I first started on, it lasted for a good probably about a good year and a half or 2, where it wasn't being productive, so I had to switch to another chemotherapy regimen and treatment, and did that for about 6 months, to really help with the burden of disease and knock it down a little bit. But at the end of 2015, my doc informed me, my oncologist, that your numbers are ticking up and it's time for a stem cell transplant. Mind you, I had collected my T cells through apheresis to have a stem cell transplant, but I just was not ready for that. I wasn't ready for that line of therapy right away.
Mhm.
And the treatments was working, so I was like, "Don't rock the boat if
Yeah.
I don't need to." So, but once it was time at the end of 2025 where things wasn't getting better for me, I knew that going into 2026, like, this is the time we have to act.
Okay. So leading up to CAR T, what was that conversation like with your doctor? How did they present it to you as an option, and what thoughts were going through your head?
Yeah, so I first learned about CAR T at a tandem conference in 2019,
Okay.
and I texted my oncologist immediately. I was at a at a booth, and right across was a big sign, CAR T therapy, and with the manufacturer's name on it, and for multiple myeloma patients, and it just struck me, Elisa, where I was just like, wow, could I be a candidate for this? Although it was in clinical trial at that moment.
Yeah.
So I text my doctor, and I said to him, is this something that I can have? And he texted me back and said, not at the moment, but we will discuss. So by the time CAR-T officially entered the conversation, my oncologist and I had built that deep trust. He presented it not as a last resort, but as an advanced targeted therapy that was changing the landscape for myeloma patients. He explained CAR-T in a personal, personalized way using my own re-engineered T cells to fight the cancer. That concept was incredibly powerful to me. Um, of course, I knew it wasn't simple. There
Right.
were risks, um, cytokine release syndrome, which is what they call CRS,
Uh-huh.
the neurotoxicity, and an intense monitoring period. I had to weigh the benefits against the realities. I remember thinking, if I'm going to do this, I'm going all in.
Yes. I love that, and, that is so important to understand the risks and the benefits also of, procedures and any medications that you're, potentially going on. It's good to have those conversations with your doctor. So why did you ultimately end up deciding that CAR T-cell therapy was the right decision for you at that time?
Yeah, I had been on nonstop treatment for years with no true break. Um, that 12 years of nonstop treatment, of hearing the beeps and infusion, the smell, being around sick people, I knew CAR T could potentially offer that drug holiday for me that I had never experienced. And I had speak with so many patients that hadn't been on treatment for 5 years. They were in remission and they didn't have to withstand that 12 years of nonstop treatment like I did. So for me, it came down to three things: timing, science, and hope. The science was strong. The data showed deep responses in heavily pretreated patients like me. I I was still physically active and in good condition,
Uh-huh.
which made me a strong candidate. But honestly, I wanted a deeper remission. I wasn't just fighting for time, I was fighting for quality of life. And the ability to continue serving others through advocacy, CAR T felt like the right step forward for me.
Yes, and we will get into your advocacy a little bit later in the episode because we do want to hear about that. Now, can you take us through the whole procedure from preparation for taking the T cells out until they infuse them back in?
Yes, so wow. The procedure the procedure began with a bridge therapy for me, and I'll talk a little more about that bridge therapy. But we started it right away. I remember having the conversation with my oncologist, who was not on my only my oncologist, but my friend, and someone that I truly trust. But it all started with chemotherapy, that bridge therapy, so I can knock the burden of disease down. And going through this whole process, you had to have EKGs, bone marrow biopsies, um, PET scans. So getting into the procedure, the process to the the apheresis part where they're collecting my T cells is similar to like people donating blood, but it's a little more invasive from that. Um, but a little longer process for me, because they isolate specific cells, and it's a form of white cells. So my cells were then sent to be genetically modified, and during that 3-4 week manufacturing window, I received that continued bridge therapy to keep the disease control while waiting for my cells to return. And before infusion, I underwent that lymphodepleting chemotherapy to make room in my immune system for the new CAR T cells. And they then came infusion day. It was May 6th of 2025, and The infusion itself was surprisingly simple. It felt almost anticlimactic for
Oh,
something so powerful, but I knew something extraordinary was happening inside of my body. And I don't regret the process at all because at the end of the day, I got the news that I always wanted, and we'll discuss that a little more.
yeah, definitely. How long did that whole procedure take, or that whole waiting period in between them taking your T cells out and then putting it back in?
Yeah, that waiting period, taking it out, that started around March, and I had them back by actually mid-March. I had them back by April, um, probably about 3, 4 weeks after that, and that's when I had um the lymphodepleting
Mhm.
chemotherapy, and the process was fairly quickly. And I think what really just blew my mind, Alyssa, was I remember having my T cells collected, and I'm in the apheresis center. And when the nurse said, "Okay, we're all done now," I remember him removing the bag and starting the process of tagging it, putting my name on it, boxing it up, having another nurse to verify. I remember the carrier coming in, collecting the boxes and verifying, and I asked the nurse, I said, "Are my T cells being shipped off to be re-engineered and manufactured now at a different facility?" He said, "Yes, they're going to the airport right now as we speak." And that just really put everything in perspective for me and just blew my mind.
Wow. That is so cool that they just pack it up, ship it right off, and get those re-engineered. So that is
Yes.
really cool. What happened after the T cells were infused back in? Did you have to spend time in the hospital? What was the period afterwards like for you?
Yeah, after infusion, I chose for myself and my family. I just did not want my family worried about me being at home through that process. So
Mhm.
I opted and chose to be in the transplant unit where I was there for about 14 days, and I was closely monitored. The first couple of weeks are critical because CAR T cells expand rapidly, and that's why side effects can occur. I did experience side effects, but my medical team was prepared.
Yeah.
Being monitored by experienced professionals was medical professionals who understand CAR T management is essential and was essential. There were moments of fatigue and uncertainty, but I also felt something shift.
Mhm.
I felt like my body was finally doing the fighting. The monitoring period required and requires patience. Um, You have to surrender control and trust the process,
Mhm.
and I did that for myself as well as my family.
That's very good. So what you mentioned a little bit of side effects. What side effects did you have?
Yes, I had the CRS side effects. I had the fevers that progressed later for me. I had that moment when those fevers started to progress, and
Mhm.
they tell you once you get to that magic number of that 101.8 up in there is like, call the emergency room, you gotta get there.
Yes.
And I did, went to the emergency room, and they were on it. I mean, they took me through that whole process and procedure to rule everything else out, they sent me back home and I was monitored every day, going back to the clinic for several weeks just to be monitored. And I also got late side effects of neuropathy. And I
Oh,
think that's been the biggest challenge for me thus far is I'm still dealing with those late onset side effects from neuropathy. Um, I'm having little small glimmers of hope. It's getting a little better.
good.
Not a lot, but it's getting a little better. So I'm giving myself those small victories because I know just the articulation from my neurosurgeon as well as my oncologist that it will get better. It could be months, it could be years, but I feel like it's not going to be years because I am getting those small little glimmers of victory and hope where it's getting a little better. But the neuropathy has been brutal.
Yeah. Yeah, it's tough to have those side effects, particularly when the procedure has gone so well. So I hope that that continues to get better for you and improve, and that's great that your doctors are feeling very optimistic about it really improving. So can you tell us about that day in September that you found out you were in complete remission? And how did they test for that to see if the CAR T cell therapy was successful?
Yeah, so wow. So on September 25th of 2025, my oncologist told me for the first time I was cancer free. I was MRD negative, and I still get choked up about it because it's something I never imagined for myself in that moment, being a high risk patient and being on treatment for so long because this is all that I knew was constant chemotherapies. So being MRD negative and getting that articulation from oncologists to say out of just under 15 million cells tested, they were all cancer free. They were all MRD negative. And to get all of that was blood work, imaging, bone marrow biopsy,
Mhm.
confirm no detectable disease. And after that 12 continuous years of treatment, hearing those words was overwhelming. I cried, I prayed, I reflected. It wasn't just about remission, Alyssa. It was about resilience. Every infusion, every setback, every advocate, every doctor, every member of my village who walked beside me, that day was bigger than me. It was truly bigger than me.
Yeah. Oh, that is so wonderful. I am so very excited for you. I do want to point out to our viewers who might not know what MRD is. It's minimal or measurable residual disease. And so you described it a little bit. So they actually look at those, a very small amount of cells. So if they did a bone marrow biopsy, there might be cells kind of lingering around still. So they can go even deeper and find out if there's really any lingering cancer cells there. And so that is so exciting that you're MRD negative and that you're continuing to do well. I'm so happy for you. And
Thank you
it's
so
just
much.
so exciting that CAR T cell therapy has really been successful. Now, before we leave today, I'd like to touch on your work as a volunteer advocate for Blood Cancer United. What
Yeah.
made you decide to get involved, and why is advocacy important to you?
Yeah, as my health challenges just continue to grow, so did my desire to impact lives. So I partner with Blood Cancer United, and 2022, and now I serve as the North Carolina State Advocacy Leader. And advocacy became my purpose. I realized that while I couldn't control my diagnosis, I could influence policy,
Mhm.
research funding, and access to care for others. Blood Cancer United gave me a platform to turn pain into purpose. So that for me has just uplifted me and continue to just move forward and help patients other than myself along the way because we need this work.
Mhm. Yeah, we hear that actually quite a bit on our audio podcast, The Bloodline with Blood Cancer United, and on here as well, turning pain into purpose. It's just a beautiful thing for blood cancer patients to do if you're so inclined and feel up for doing something like that. Now, I would like to hear what important public policy issues or bills you have advocated for.
Sure. Wow. I've advocated for so many, but step therapy reform, Medicare Part D cap and smoothing provisions, which was great for North Carolina. Medicaid expansion, which was such a big deal. Um, tax credits and healthcare and enhanced premium tax credits, which is what we call EPTCS, or parity. And gosh, I have to highlight this really big one is the Accelerating Kids Access to Care Act, the AKACA, which was just passed across the finish line a few weeks ago, which just brought tears to my eyes. Reforming prior authorization barriers, increased federal research funding, protecting access to innovative therapies like CAR T, expanding access to clinical trials. There is so many, but that access matters.
Yes.
Policy determines whether patients receive life-saving treatments or don't. And the most powerful part, I'm still in it, still serving, still showing up for my village, still fighting for access for others that don't have to fight as hard. And that's so rewarding for me.
Yeah, I think that's such an important thing that our public policy team at Blood Cancer United and volunteer advocates like yourself really do. And you go out there and you share your story. So you're not just a number on a spreadsheet to lawmakers. You're a person. You're a person sharing your personal experience. And I love a lot of the things that you touched on were healthcare access, like Medicare, Medicaid, to make it affordable and accessible for patients, but also oral parity, which for viewers who don't know, that is for insurance companies to actually cover drugs that are taken by mouth rather than having to go in and get an infusion in
Yes.
a cancer center. And so it has been so wonderful for patients to be able to take these medications at home and have it be covered by insurance. And of course, these recent acts that were passed for children's access and research are so important. So thank you for sharing your story to lawmakers so that you can show a real person that is being affected by this. And we have volunteer advocates all across the country who are going out there and sharing their personal stories and getting these things passed. And I'll be sure to put a link in the underneath us right now. So check that out, and you can see a bunch of the different things that public policy has worked on, or sign up to be an advocate yourself, like Tony here.
Yes.
So, our final question today: do you have any final thoughts for our patients and their loved ones to give them hope if they are considering or currently are in the process of receiving CAR T cell therapy?
Yes, I'll share a few final thoughts. I'll say first, educate yourself. I think that's important. Educate yourself, but don't let fear make the decision for you. Um, Secondly, build your village. You can't go through CAR-T alone or this whole journey that you're on. Your caregivers, your friends, advocates, they're all essential. Um, Thirdly, remember that science is evolving rapidly. Um, CAR-T is not the end of the road. It's part of a revolution in personalized medicine. I think that's extremely important. And finally, hope is not naive. Hope is powerful. I stand here as someone who fought for almost 12 years and is now in remission because of innovation, advocacy, and faith. Going on soon to be 13 years in September, I'll say to you as well, if you are in the middle of the fight, keep going. Your story isn't finished yet. My story isn't finished yet. I thank you all. I champion for you. I fight for you. I support you. And I'm always here for you. Thank you for the opportunity.
That is such wonderful advice, Tony. And I love how you talked about CAR T cell therapy really just continuing to get better and to open up to more diseases. And there is so much hope for the future with CAR T cell therapy, and that it is personalized medicine. It is targeted therapy to you as an individual for your type of cancer, the way that it is. And so that is so important to understand. But thank you so much, Tony, for coming on here and sharing your story all about CAR T cell therapy. I hope that patients that are considering it are feeling much better and feeling hope for this therapy and hope for the future for their disease management and hopefully cures in the future. I think we've got a little time to wait to see if CAR T cell therapy will be a cure. I think they have to look for over 10, 15 plus years, but we're excited for the future of this. And we recently did an episode with Dr. Richard Maziarz and Bashi Rattery of OHSU in Portland, all about CAR T cell therapy. So patients can visit the link below to listen to that episode on the Bloodline with Blood Cancer United. And also, please visit the link below for more information on CAR T cell therapy. And I just want to thank everyone for tuning in today. Thank you, Tony, as well, to our latest episode of Bloodline Breakthroughs, Innovations and Inspiration. We look forward to seeing you next time.